Now, weight gain in pregnancy. And I'm going to fly through these topics, guys, because there is lots to talk about. But weight gain in pregnancy is probably one of the biggest questions that you will get with your prenatal clients. How much weight am I going to gain? Can I diet? Can I count my macros? All of these really important questions. And so I want to give you an insight into how the recommendations are provided to women who are pregnant and what you can ultimately do with those recommendations. So the recommendations, and Maria, I do apologize. I actually changed all of the colors on the Canva backgrounds, but it's pink. So I'm sorry, my OCD. But we can see it, so it's good. The recommendations for weight gain during pregnancy it's quite nuanced, and some countries don't even have recommendations of how much weight a woman is recommended to gain. Australia follows pretty closely behind the recommendations that the US suggests to women. And we talk about BMI, and I know that BMI is a very controversial topic, especially among sort of the bodybuilding population, because we know that there are some limitations with how that tool is used. But in a general consensus, when we take away a few outliers, it's a pretty reliable tool that can somewhat predict the potential risk factors that person might experience, right? And so what we see in the recommendations during pregnancy is it depends on that person's pre-pregnancy BMI. And that's how we make the recommendations about how much weight, so kilograms, pounds, your client should be gaining. All right. So insufficient weight gain and limited dietary variety during pregnancy can harm a developing baby, neurologically and for the rest of their life as well. And a lack of weight gain and not enough weight gain can include very severe consequences like preterm birth or low birth weight. And this is not something that we want with new little babies. Now, on the flip side, women who are overweight, and you guys will get this a lot with your clients when you step into this space, women going into pregnancy overweight are very aware that they're going into pregnancy overweight. And they're very aware that they will likely gain more weight throughout their pregnancy. And so one of their questions is, can I diet? Can I lose weight? Should I be trying to lose weight? Okay. Now, this is a nuanced discussion that I'm more than happy to go through at another time when we're looking at preconception. But if you are working with a client who is pregnant, no matter what their pre-pregnancy BMI was or what their BMI is now, dieting is never safe in pregnancy and is way without of our scope to even recommend that we would do that, okay? And that probably sounds like, well, that's common knowledge, but truth be told, it's not common knowledge. So what I want you guys to think about is when you have a client who is overweight going into pregnancy, or they were overweight going into pregnancy, I want you to think weight management, not weight loss. We're never putting them in an intentional deficit, and the goal is never to see their weight come down, okay? But it is extremely important to ensure that that woman is gaining an appropriate amount of weight. And I think that it can be a really helpful discussion to have with your clients about the potential risk factors of gaining too much weight throughout pregnancy. And, you know, women who do gain more weight than is recommended often have larger babies at birth. And it's a lot harder for them to lose the weight postpartum. And when I say that, it goes far beyond aesthetics, okay? And people are allowed to want to improve their aesthetics. I think that we should empower people who want to for the right reasons. But carrying too much weight has negative health consequences, as we all know, right? Having too much or gaining too much weight in pregnancy also places the woman at increased risk of conditions like preeclampsia and gestational diabetes, which can have really, really profound consequences for her and her baby, either throughout the pregnancy or at birth as well. Now, women adhering to the guidelines typically have normal sized babies, which is always good when you're giving birth to an actual human, and lose more weight after childbirth independent of their pre-pregnancy BMI. So it's a pretty good predictor in terms of what their postpartum period might look like as well. Now, these are the recommendations. I am giving you these recommendations in kilograms because my brain works that way. I'm from Australia. I don't work in pounds. I'm so sorry, guys. You'll have to do some conversions. But I'm just having a look and making sure that this is right, because this does not look right to me. Okay, I want you guys to look at this one, okay? And I apologize for this. The healthy BMI, or the normal BMI, this is not the recommendation in terms of weight gain. It's around 12 to 16 kilos. And I'm going to make a change in that, and I'll send Maria the slide with the updates. But everything else here is correct. What I want you to do is I want you to look at how the recommendations actually work. And what you'll notice is that women who are underweight are recommended to gain more weight throughout their pregnancy. Women who are of a normal BMI are recommended to gain less. So again, just repeating that would be somewhere around 12 to 16 kilos, not 18 kilos. And then women who are overweight and then women who are obese will be recommended to gain even less weight throughout their pregnancies. So 7 to 11 kilograms if they are overweight. And if they have a BMI of 30 or more, they're recommended to gain even less weight. And this can be really challenging. I don't know if anyone here has kids, but in both my pregnancies, I had very healthy pregnancies. It was very easy to gain 16 kilos because when you're gaining weight, that's not all maternal fat gain, right? We have a baby, we have a placenta. Women grow a whole new organ during pregnancy. They have amniotic fluid. They have an increase in cardiac output and fluid volume, among just a variety of other things that are happening with changing hormones and all the weird, wonderful things that happen during pregnancy. So a lot of the weight, if you are staying within the recommendations, won't actually be maternal fat. There will be some because that's really important for breastfeeding, but not a lot if you're sticking within the recommendations. So for a woman who is, a BMI of 30 and above, gaining 9 kilos, that is easy to do just in baby, amniotic fluid, placenta, etc. It's actually really challenging to get women to stay within these parameters, okay? And so one of the things that, is really important to me is the art of coaching and realizing that we have this knowledge that we acquire, but we take these to human beings who are going through a very, very, very big change in their life. And, I don't know if you've heard Lane say, one of the mottos that we have at Team BioLane is coaching with accountability and empathy. And you can't have one without the other. So making your client aware of, hey, and I get these charts out when I'm coaching my clients and saying, this is what's recommended. This is where we would like you to sort of sit throughout your pregnancy. But I also just want to make you really aware that this is a challenging goal to work toward. And I don't want you to experience shame or feel like you're doing anything wrong if this isn't how it goes. This is where we aim toward, and hopefully we get there. But please just know that 9 kilos is probably going to be just your placenta, your baby, and all of the other things. And the best thing that you can do, and the best thing that you can do as the coach, is to just encourage your client, despite the outcome, despite the scale and everything, keeping them active and getting them and helping them to consume a well-balanced diet is the best thing that you can do, irrespective of what happens here.